friends, welcome back to the channel where we talk about mental health, personal growth, and everything in between. Today we're going to talk about depression, what it is, how long it lasts, and most importantly, the research-backed ways to get out of it. First, what is depression? Depression is a mental health disorder characterized by persistent sadness, low mood, loss of interest or pleasure, and a lack of energy. It affects millions of people worldwide, and it's essential to recognize that it's not a sign of weakness, but rather a medical condition that requires treatment. In the US alone, it's estimated that 17.3 million adults, or about 7% of the adult population, has experienced at least one major depressive episode in their lifetime. Count me in on that statistic. I've had my fair share of major depressive episodes lasting about a week or more, and I was so desperate to get out of it, I decided to try these tactics. I'm happy to report that they actually helped. That leads us to the next question. How long can depression last? The duration of depression varies from person to person. Some people experience short-term depression that lasts for a few weeks or months, while others may suffer from long-term depression that lasts for years. Yes, I said years. It's crucial to seek professional help if you think you're experiencing symptoms of depression. The first research-backed way to get out of depression is to use modern medicine. Antidepressant medication is often prescribed to help manage the symptoms of depression. These medications work by altering the level of certain chemicals in the brain, such as serotonin and norepinephrine. It's essential to speak with your doctor to find what's the right medication and dosage that works for you. It may take a while for you to find the right medication, but it's so worth it in the long run. Second, therapy can be an effective treatment for depression primarily by providing a safe and supportive environment where you can share your thoughts and feelings. Personally, I've been having my weekly therapy sessions for over 20 years now. Most importantly, I like how you can uncover underlying issues that are contributing to the depression. Therapy can help by developing coping skills and strategies for managing symptoms. You can identify negative thought patterns and develop alternative, more positive ways of thinking. If I haven't convinced you enough to get help, take a look at these other benefits of therapy. A positive shift in your perspective and understanding of yourself, leading to improved self-esteem and better decisions, identifying distorted thinking patterns and replacing them with healthier alternatives, and learning how to cope with stress, manage emotions more effectively, and improve interpersonal relationships. Yes, it can do all that and more. Now, let's get into the other things you can do at home to get out of depression. This would be our third research-backed way to get out of depression. Practicing gratitude is a simple yet powerful way to improve your mental health. It involves taking time each day to focus on the things you're thankful for, such as your health, your relationships, and even your accomplishments. Gratitude has been shown to increase happiness, reduce stress, and improve overall well-being. So bust out that 5-minute gratitude journal I once talked about and start a daily gratitude practice. Now, fourth up is meditation. Meditation is a mindfulness practice that involves focusing on the present moment and calming the mind. It has been shown to reduce symptoms of depression and anxiety by regulating the activity in the prefrontal cortex, the part of the brain responsible for emotional regulation and decision making. On a similar note, there is mindfulness. Let's keep mindfulness and meditation in the same bucket, even though they're two different practices. Mindfulness is a state of being aware of the present moment without judgment. It involves focusing on our thoughts, feelings, and sensations without trying to change them. Mindfulness-based interventions have been shown to be effective in reducing symptoms of depression and anxiety. Sometimes all it takes is for you to sit calmly and to think about how it's so great in the present moment. Finally, fifth, there's exercise. Yes, exercise. Now, who likes doing that? But it works. Regular exercise has been shown to improve mood and reduce symptoms of depression. Exercise has been found to increase the levels of endorphins and other neurotransmitters in the brain, such as serotonin and dopamine, which can help regulate mood and reduce symptoms of depression. In addition, exercise has been shown to reduce inflammation in the body, which has been linked to depression. The amount of exercise required to see benefits for depression can vary depending on the individual and the severity of their symptoms. However, studies have generally found that exercising for at least 30 minutes per day, 3 to 5 times per week, can be beneficial. This can include activities such as brisk walking, jogging, cycling, or swimming. I like to jump on my Peloton and put on a Cody Rigsby-led ride. All of these methods work by changing the activity in specific parts of the brain. Antidepressant medication alters the levels of neurotransmitters in the brain, which can help regulate mood. Gratitude practice, meditation, and mindfulness all increase activity in the prefrontal cortex, which can help regulate emotions and reduce symptoms of depression. Exercise also increases activity in the prefrontal cortex and releases endorphins, which can improve mood. Now, depression is a challenging mental health disorder, but it's essential to remember that it's treatable. Seeking professional help is the first step in managing your symptoms, and incorporating these research-backed methods into your daily routine can also help improve your mood and overall well-being. Remember, it's okay to not be okay, and asking for help is a sign of strength and not weakness. Again, asking for help is a sign of strength and not weakness. Mental health is just as important as physical health. If you're interested in learning about what bipolar is all about, you can watch that video too. Thank you for watching, and don't forget to take care of your mental health. Thank you and so long!